If you clicked on this video, then you're probably eligible for Medicare. You're turning 65, maybe you're losing work coverage or some other qualifying event. You don't really know what to do. You're confused and overwhelmed. And if you're like most people, an everyday trip to the mailbox is such a daunting process. You get mail and advertisements from many different companies that you don't even have the chance to read it before you turn 65. Your neighbors are telling you what to do, and then, hold on one second, the calls. Hello? Yeah, no, I'm not interested. My name is Doreen Marino, and I work with people just like you, helping them navigate and understand the Medicare market. I'm able to help you understand what you need to do to sign up for Medicare, clear up the common misconceptions, explain what exactly are the penalties and who they apply to, and discuss how an Advantage and a supplement plan work, all while giving you an unbiased, non-company driven answer. So turning 65 should not be a complicated process. Come, follow me inside to learn more about Medicare so that I can help simplify it for you. Hi, welcome to Understanding the Basics of Medicare. There is a lot of information to go over, so sit back, relax, or take out a pad of paper and a pen and take some notes. I'm going to provide you with information that's going to help you make an educated decision when picking a health insurance plan. I would like to go over today Medicare Parts A, B, C, and D, explaining how and when to enroll, what are the rules and penalty, talk about your prescription drugs, supplement versus Advantage, and what are the steps you need to take in order to enroll in a plan. So to begin with, Medicare is health insurance for those 65 and older, for anyone who's under 65 that has certain disabilities, and for those that are on dialysis and have permanent kidney failure. It's a federal program put in place by the government in 1965. Don't let this be you when it comes to your Medicare options. I'm going to help you explain what your choices are so that you can really make the best decision for yourself, clear up the misconceptions, and help you understand the process a little bit better. Starting with, when do I need to enroll? There's a 7-month window which to enroll with Medicare. It starts with the month of your 65th birthday, 3 months before, 3 months after. My birthday's in April. I have January, February, March, April, May, June, and July to enroll. Enrollment is not automatic. Only if you're currently receiving Social Security or if you apply for Social Security benefits will you be enrolled in Parts A and Part B. Otherwise, it's a simple process. You just need to go to ssa.gov. Enrolling online is easy, a few quick questions, or you can call the Social Security office directly and they'll make a phone appointment. If you miss that 7-month window and you're over 65 but you have no coverage at all, you're only allowed to sign up January, February, or March, and your enrollment doesn't take place until July of that year. There are penalties, so please don't let this happen to you. One of the biggest things people ask me is, what if I'm still working, or maybe not me, my spouse? I'm covered under my spouse. So if you work for a company with 20 or more employees and you have group insurance that's deemed as good as Medicare, you do not need to enroll in Part B. You will not be penalized since you have credible coverage. What most people do is they'll enroll in a Part A plan because it will not cost them anything. If you're retired and you have company or union benefits, please check with that union or company to see how Medicare coordinates. So for example, let's say you retire at 60 and now you turn 65. You don't know if you need to enroll in Medicare or not. Please check with them. There are penalties. We've all heard about the penalties, and they're lifetime penalties. So if you do not enroll in Part B when you're supposed to, you're penalized 10% for every 12 months that you didn't sign up. Part D is a 1% monthly that you didn't sign up, multiplied by the average drug plan cost. So if you do not enroll in 1 year in a Part D plan, it's about $35 times 12%. It's roughly $4. But that becomes $4 a month that gets added to your monthly premium. So for that $35 plan, you are now spending $39. So please, even if you're not taking medications at 65, enroll in a plan to avoid the penalties. Here is just a summary of all the different ways you can sign up. Your initial enrollment period is the first 7 months, which you turn 65. If you miss that, your general enrollment period is January through March. The SEP, or special enrollment period, well, that's when you lose work coverage if you haven't enrolled at 65. And you have 8 months which to enroll in Part A and Part B, but most people will do it within 63 days to make sure that there are no pre-existing conditions and you don't have to be rated by a plan. Annual enrollment period every year, October 15th to December 7th. You're able to review plans, switch plans, making sure you have the best coverage. And if you miss that annual enrollment period, you have a one-time change. It's called open enrollment, January through March of the following year. Starting at the beginning, there are 4 parts of Medicare, A, B, C, and D. A covers your hospital, B covers your medical. That's original Medicare. It's a federal program sponsored by the government. Part A covers hospital, inpatient hospitalization for mental health, an illness, or an injury. Home health care, skilled nursing facilities, that's the rehab. You have hip or knee replacements, you break a bone, and any blood transfusion. Medicare covers everything if you're hospitalized except for $1,484 for days 1 through 60. 61 through 90, everything but $371 per day. And days 91 to 150, all but $742 per day. And these are lifetime days. Skilled nursing facility, the first 20 days are covered. Days 21 to 100, it will cover everything but $185.50 per day. And anything over 100 days, your hospital coverage is not covering. Part A is generally free for people who've worked 10 years and 40 quarters. Part B, this is your doctors, your lab work, any minor surgeries that are done outside the hospital, physical therapy, therapy visits, mental health, your equipment, a wheelchair, your glucose monitors for diabetes, ambulance, home health care. Medicare will pay, after you've paid your $203 yearly deductible, 80%. It's of the approved cost. After they pay 80%, you're going to pick up the next 20%. Part B premiums. There is a premium to be enrolled in Part B. It's a monthly premium. That premium increases as your income increases. Generally, it's $148.50 per month for most people if they have a joint return under $176. But as you can see, the most will be $504.90. Part C are Advantage plans. They're A and B combined and include prescription drug coverage. They also are the ones that have those additional benefits like prescription eye, hearing aids, and dental. You need to still be enrolled in A and B in order to pick up a C Advantage plan, and these are pay-as-you-go plans. You're going to pay a copay, coinsurance, deductible as you use them, and you need to live in the area that you're in order to enroll. So if you live in Suffolk, you have to pick up a Suffolk plan. Part D are prescription drug plans. Those are offered through private insurance companies. They could be a standalone drug plan or combined with an Advantage plan. Medicare provides a formulary, which is the list of drugs that should be covered. There are over 30 different prescription drug plans out there that come up with their own formulary based on Medicare's, but there has to be at least 2 medications in a classification to be covered. The drugs are put into different tiers, different levels called tiers, and they vary by cost. So tiers 1 and tier 2 are your preferred and your preferred generics. Those are the medications for blood pressure, heart, diabetes, the statins that most people take. Tier 3 is your brand. Tier 4 and tier 5 are your specialty medications. With these drug plans, there's different rules. There are things called formulary exceptions where you can apply to have a medication covered. There's tier reductions. There's step therapy where you need to take 2 or more medications before they'll cover the expensive one. Prior authorization for certain medications. With drug plans, it's always good to look up your own, analyze, see the medications that you're on, and take a look at it each and every year. It does not matter what your friend or your neighbor or even your spouse has. Part D premiums go up with income as well. Medicare gives you choices. The first step is to enroll in Medicare Parts A and B. You need to have that regardless. Then you pick your option 1, whether it be picking up a supplement plan along with the prescription drug plan D or an Advantage plan that includes prescription drugs. You cannot have both. You could only have one plan. So the next question really is going to be, well, what do I choose? What is the best plan? There really is no best plan. The best plan is the one that suits your needs and is affordable to you. So what I tell most people is, as long as you understand how a supplement and an Advantage plan works, what are the pros and cons and the benefits to you, then you're going to make the right decision for you. And please, the plan that you pick today or when you're turning 65 may not be the plan that you have in 10 years because your needs will change. So as long as you pick a plan, understanding the way it works and review it every year, you're going to make sure that you have adequate coverage. In fact, I do find that many husbands and wives sometimes don't always pick the same plans because their needs are different. A supplement plan is called a Medicare plan. So those are the lettered plans. You hear A, B, C, D, E, F, G. Just joking. But these plans are standardized, meaning that the coverage is the same. Plan G is Plan G is Plan G, regardless. The only thing is that the premium is going to differ per company. So it doesn't matter what state you're in, it's going to cover the same services. Typically what you find is the more comprehensive a supplement plan is, the higher that premium is going to be, the more it's going to pick up those out-of-pocket costs. And a supplement is going to cap the cost of the things that Medicare doesn't cover, but only if it's a Medicare covered service. So this is really important. If Medicare does not cover that service, the supplement plan is not paying. Medicare needs to pay for it. The out-of-pocket gets paid by the supplement. There's no network of doctors, no prior authorizations or approvals. So the doctors in the plan, the network is really all the doctors that accept Medicare. You do need a separate prescription D plan, and a lot of times this works well for people that have 2 state residences. If you look at this chart, here is Plan G. Plan G currently is the most comprehensive plan out there for those turning 65 after 2020. It's going to pick up all 365 days in the hospital, your Part B coinsurance, any blood, Part A hospice coinsurance, the skilled nursing facility, all 100 days are covered. Part A deductible of the $1,484, the excess charges and foreign travel. What's not covered is that Part B deductible of $203. So once you pay $203 and your monthly premium, you will never pay any out-of-pocket expenses with Plan G. And there are other plans to go over, but just to give you an idea how that would work. As you can see, each plan covers varying amounts. Advantage plans. So these are also private insurance company plans. They replace original Medicare, but you're not losing original Medicare. You still need to continue to pay your Part B premium. And a lot of the benefits in these plans include dental, vision, and hearing. You hear it on the commercials all the time. There still is a monthly premium for Advantage plans, but you'll find a lot of Advantage plans do have a 0 premium plan. They are HMOs or PPOs, very similar to the work plans, what you're used to. But don't be fooled by the HMO or PPO. An HMO could have a really big network and not have referrals and be as good or if not better than a PPO that has a very small network, and you're always going out of network and paying more for those services. So really analyzing the network and what it's going to cost you is important with an Advantage plan. What you're going to pay is as you use the services. You're going to have a copay, which is your fixed amount, a coinsurance, you'll see a percentage of the cost, and a deductible. That means what you have to pay before the insurance company ever pays anything. Besides from looking up your doctors and stuff, a lot of times some of the things you need to see, is it affordable? Are the doctors in the network? Are my prescriptions covered? What are my out-of-pocket costs? So it seems like a lot of information. And now that you have the basics, like what do? Do you call up all the insurance companies and find out if the doctors are in network and what are your costs for your prescriptions? Well, working with a broker, someone who works with all the insurance companies, can help give you guidance, compare the plans for you, help you understand what the cost, penalties, avoid mistakes, and most importantly, enroll you to make sure your coverage is there when you need it. My name is Doreen Marino, and I am an independent broker. I have relationships with the carriers in the market, so instead of calling an 800 number, you have me as your liaison to call and help you understand how the plans work. There are no fees for my services. As far as compensation goes, the insurance companies are compensating the same across the board. So whether you're an independent agent, whether you're work directly for the company, they're paying the same fee. If you were to call up the company, you're not getting a better rate by calling directly to the company. It is the same rate. And as a matter of fact, if you were to call the company, they're not going to tell you that there might be another company out there that might be better suited for your needs based on what you're looking for. So if you would like, I provide comprehensive, no-cost consultations to compare plans. My number is 631-235-8038. There's a survey at the end of this. If you fill it out and answer some questions, it will be a little bit easier. I'll get a better understanding of what you're looking for. You can always go to my website, check me out there. I'm licensed, and send me an email at Medicare by Doreen at Gmail. Again, thank you for taking the time to listen to this. I hope that I have provided you with some educational information and been able to help you make your decision.